Started. I'm going to go ahead and record the session. And there may be a couple new people here. I love that we have hope in this room. Literally and figuratively speaking, we try to bring hope to all of you. Hope for situations that you haven't had much hope for in the past. Is there anybody who wants to share how they wound up with the classes, if you're new, or who referred you, what you might hope to get out of them? We like to kind of start that way. Most people have been here before. I don't know. Hope, are you a new player? I see your microphone is unmuted. All right, well, I'll go ahead and, scared her out of the room. Oh. Or him. Hopefully they'll be back. Okay, so anyway, we have Scott back from his CME conference, and maybe he could share a little bit with us what some of the highlights of that, what he learned before we continue on with our session tonight, which is going to be on osteoporosis, for those of you who are here, apparently are interested.
Yeah, a lot of great speakers. I'll write up a article with more details in the Eugene Plant-Based Provider newsletter for next month, for September. But there was probably, didn't get an official count, probably several hundred, maybe 600-700 be my guess there. Mostly physicians, lots of dietitians, people from all over the country. There was people from Indian countries, Australia, UK, Ireland. I can remember even some of our speakers were from abroad as well, but lots of really good speakers. We had a lot of kind of the latest science on. We did actually I don't know if you guys recall in the newsletter where I wrote up those 2 studies that on the COVID, on the less chance for having moderate to severe symptoms on COVID when the people that were on the plant-based diet. I actually saw the presentations of those. The people that actually did those studies were actually there, so that was pretty cool. Kim Allen Williams, as always, was there. Really, he's a really good. He's just a data junkie. Like I don't know anyone that knows the science and the studies better than he does. And he actually did a nice update on Mediterranean diet, the PrediMed study, and I'll go over that in more detail in the newsletter, because that was kind of, I learned some things there from updated data on that. And then, as always, Dean Ornish was really deep in his discussion, really valuable information that he shares. Trying to think of some of the other highlights, but really good food. That was always a big highlight. And then I think what I always really enjoy about those conferences is, and having not been able to do one the last 2 years because of COVID, just being together, we wore masks and we took COVID tests before, and you had to be vaccinated to be there. And so they took a lot of precautions. But I think one of my favorite things when I'm always there is just hearing the stories of how the providers got into nutrition, because as you know, we don't learn about it in medical school. And so it's like a lot of the presenters would talk about how they got into it. And a lot of times it was because they had their own health problems, and just like Charlie and I talked about how we got into it, and then that's what inspired them, or a patient inspired them or something like that. And so that's why you guys have so much power or so much impact on your medical providers. If you make the changes and get healthy, and then you might inspire your provider to study the nutrition and maybe make the change, and they maybe someday they'll be presenting at these conferences. So it's really that's always a really inspiring part of it. And then they present the science on a particular topic, and so that's always kind of the inspirational stuff. But I'll put in some more highlights for the newsletter in a couple weeks.
Great. Okay, anybody have any questions, any thoughts? If you speak up now, that's great. And if not, you can wait till later. I'll give you a few more seconds to make a decision.
And also, hopefully, people can come to the walk. Just a reminder that the third Eugene Plant-Based Provider Community Walk is coming up on this coming Saturday at 10 o'clock. Same place as last month. They're at the Valley River parking lot, right by the bicycle footbridge there. Information's in the Eugene Plant-Based Provider website under the upcoming events. Also, there's a link to that in my email from Sunday. So hopefully I'll see some of you guys there.
So JJ had a event on the other side of the river, starting at what's the park, Maud something or?
Maud Williamson, is it? Or
something.
Something, yeah. It's on the other side, yeah, right on the other side of the river.
And walk to the Rose Garden. So if you start where you're starting, if you walked over the river and you went to your left, they've got this beautiful rose garden. It's pretty amazing. It'd take about 20, 25 minutes to get there.
Well, that's where we walked at the one 2 months ago, to that rose garden.
Did you?
Yeah. So people that went a little bit further went to the rose garden there on that side. That's where we
beautiful.
Were. Yeah.
Yeah. All right. Well, I hope a lot of people show up and you'll have a lot of fun. It's a beautiful environment. Okay. Any other thoughts, questions, concerns?
Yes, Charlie, I had a thank you to both of you for answering my email. I hope you address why someone like myself has osteopenia or osteoporosis. Before these classes began, I ate very little meat, a lot of fruit, organic vegetables, exercised 3 days a week, resistance training and everything, and yet I still developed osteoporosis. Now, I've lost 1 inch in height. I'm 77 now, and I hope you will address that. I don't know what else to do. I eat, well, no meat right now, but I don't know why I have the problem, unless for some of us it's heredity. But I don't know of any relatives who had it. So I'm confused at why I have this. And if you could address that sometime during the class, I'd appreciate that. I'm looking forward to what you have to say and to the videos.
Well, glad you could make it. And we'll start out with, perhaps it'll answer it in this next kind of article, but perhaps it won't, and we will try to get to that at some point in time, okay? Thank you for asking about that. And let's see, it says participants can now see your screen. Can you really see my screen?
Yep.
Okay, I'm going to try to get that out of the way. And then I'm going to bring this up. And here we go. So what's the main cause of osteoporosis? It's a bone disease that causes your bones to be weak and more likely to break. But most people don't know why they have osteoporosis until they break a bone. It affects about 20% of women aged 50 and over, and about 5% of men in that same age group. And the main cause of osteoporosis is bone loss, generally due to lower estrogen levels. So estrogen plays a part in maintaining and building the bones. And in women, your estrogen levels drop off significantly during menopause. And men, they have a more gradual decline in their sex hormones, so they don't tend to have the problem. So again, less estrogen has generally been thought to be the cause of osteoporosis. So in years when I first started practicing, we used to put all women on menopausal women, just about everyone, on estrogen supplements. Premarin was the big one. It was made from horse's urine. People didn't like that, so they came out with synthetic preps. And then as they started studying the data, they found that women who were taking this estrogen after they went through menopause began having more rates of breast cancer. And so the cancer scare led to most physicians stop the prescribing of estrogens postmenopausally. And so, I guess it's there are choices that you make. It may be that you have one strategy to help prevent one type of problem, and that may make the other one worse, and vice versa. So there are some risk factors for osteoporosis. Age is one of them. It's usually after the age of 50, although people can get it before then. And body size, you're at greater risk if you're slender and have thinner bones, because you may have a lower muscle mass, lower estrogen, less fat to pad your bones during a fall, and possibly poor nutrition. That's hopefully not the case when you're eating whole plant foods. Your nutrition should be buffed up. Your weight will likely go down. So in one sense, that could put you at a little more risk, but then the benefits of having a little less weight because you're eating a whole plant food diet are, less risk of dying a heart attack, diabetes, suffering those consequences, less risk of cancers. And so, if you have a scale and you're putting the diseases, piling them up, you have kind of osteoporosis sitting out here. Maybe there is some slightly increased risk associated with eating a whole plant food diet. But there are so many other benefits that are actually our number one killers that, I would find it difficult to encourage people to gain weight, to provide them more cushioning for when they might fall. I think that preventing heart attacks, diabetes, strokes, cancer, arthritis, autoimmune disorders, it so far outweighs the benefits. But if none of those other conditions worry you and the only thing you're worried about is osteoporosis, then you may have to do some further thinking about what choices you personally want to make. We've talked about gender and menopause, and there are some medical conditions that can lead to osteoporosis, like certain people have eating disorders who are, like bulimia, eating and throwing your food back up so you get malnourished. Sometimes abnormal thyroid hormone levels can lead to some bone loss. Conditions that affect your ability to move about, like stroke, paralysis, Parkinson's disease, that can increase your risk. And some conditions where you're used to using steroids. Steroids tend to decrease your bone mass. So people with lupus, sickle cell disease, rheumatoid arthritis, if they're taking steroids, that can kind of decrease their overall bone mass. So lifestyle factors are important. Your risk for weak bones is higher if you don't exercise enough. You don't get enough vitamin D and calcium. You don't eat enough vegetables and fruit. Smoking can damage your bones, can kind of thin them out. And drinking a lot, like long-term heavy drinking, can weaken your bones. And the symptoms of osteoporosis are minimal to none. Oftentimes, you just don't know whether you have osteoporosis uh, unless you get a scan or you have a fracture that occurs. And then they start doing x-rays and say, hey, your bones are thin or whatever. And you can have other things that can be symptoms like back pain or hunched posture, curve in your back, like in the mid-back, thoracic spine area, sloping shoulders, loss of height. Those could all be indications that you might have some fractures in your spine. You may want to get some x-rays to evaluate for that. So the current recommendation for checking for osteoporosis is using a DEXA scan. It uses a very low amount of radiation. You must be careful because different machines may provide different results. Different positions can affect the results by a significant amount. And Pam Popper on YouTube has done an interesting video that you may be interested in watching. She is not a believer in DEXA scans, and she gives her reasons for that. But currently, that seems to be the consensus of how to evaluate for your bony structure. So if you want to improve your bone health, you quit smoking, you limit your alcohol intake, you exercise regularly, you get enough vitamin D and calcium in your foods, not in your supplements, as you'll learn tonight. And then you want to, of course, prevent falls at home by having your eyesight buffed up and your hearing buffed up, like make it as good as you can get it. Be careful if you have blood pressure drops, feel lightheaded when you stand up, go a little slower, wear non-skid shoes, be careful when walking on slippery or icy surfaces, get enough sleep. And let's see, what else? I think that's it. That's a brief introduction to a topic which is frightening to many. When I graduated from medical school, I didn't even know what osteoporosis was. And yet with the diets that we've been eating and the lifestyle, the sedentary lifestyle we have in the United States, and the amount of smoking and drinking, osteoporosis, and the technology of DEXA scans, and of course, drugs by the pharmaceutical industry promoting the benefits, leads you to take this more seriously. Okay, so let's get on here. We used to believe that bones just thinned out because, you ate a diet which broke down into acid products and it thinned out your bones. And we've since found out that it's slightly different than that. I'm going to play a couple videos for you. Let's see, where are they? Which kind of leads you to the answer of what happens to the calcium. But first, we're going to talk about milk. We live under myths in our culture, and one of them is milk does a body good. So is milk good for our bones? Let's check out what Gregor has to say.
Milk is touted to build strong bones, but a compilation of all the best studies found no association between milk consumption and hip fracture risk, so drinking milk as an adult may not help bones. But what about in adolescence? Harvard researchers decided to put it to the test. Studies have shown that greater milk consumption during childhood and adolescence contributes to peak bone mass, and is therefore expected to help avoid osteoporosis and bone fractures in later life. But that's not what they found. Milk consumption during teenage years was not associated with a lower risk of hip fracture, and if anything, milk consumption was associated with a borderline increase in fracture risk in men. It appears that the extra boost in total body bone mineral density you get from getting extra calcium is lost within a few years, even if you keep the calcium supplementation up. This suggests a partial explanation for the long-standing enigma that hip fracture rates are highest in populations with the greatest milk consumption. Maybe an explanation why they're not lower, but why would they be higher? This enigma irked a Swedish research team, puzzled because studies, again and again, had shown a tendency of higher risk of fracture with a higher intake of milk. Well, there is a rare birth defect called Galactosemia, where babies are born without the enzymes needed to detoxify the galactose found in milk, so they end up with elevated levels of galactose in their blood, which can cause bone loss even as kids. So maybe, the Swedish researchers figured, even in normal people that can detoxify the stuff, it might not be good for the bones to be drinking it every day. And galactose doesn't just hurt the bones. That's what scientists use to cause premature aging in lab animals. They slip them a little galactose, and you can shorten their lifespan, cause oxidative stress, inflammation, brain degeneration, just with like the equivalent of 1 to 2 glasses of milk's worth of galactose a day. We're not rats, though, but given the high amount of galactose in milk, recommendations to increase milk intake for prevention of fractures could be a conceivable contradiction, so they decided to put it to the test, looking at milk intake and mortality, as well as fracture risk, to test their theory. 100,000 men and women followed for up to 20 years. What did they find? Milk-drinking women had higher rates of death, more heart disease, significantly more cancer for each glass of milk. 3 glasses a day was associated with nearly twice the risk of death, and they had significantly more bone and hip fractures too. Men in a separate study also had a higher rate of death with higher milk consumption, but at least they didn't have higher fracture rates. So a dose-dependent higher rate of both mortality and fracture in women, and a higher rate of mortality in men with milk intake. But the opposite for other dairy products like soured milk and yogurt, which would go along with the galactose theory, since bacteria can ferment away some of the lactose. To prove it, though, we need a randomized controlled trial to examine the effect of milk intake on mortality and fractures. As the accompanying editorial pointed out, we better figure this out soon, as milk consumption is on the rise around the world.
Okay, I'm going to stop for a moment and see if there are any questions from anyone. See if Scott has any input.
I would just say, kind of going back from before too, and we're kind of getting into the weeds on the different ins and outs of risk factors and things like that. It's just to remember about the blue zones. So you guys all know about the blue zones, the 5 blue zones, where people have been eating a mostly plant-based diet, exercise, lots of purpose in their life, low alcohol intake, rarely smoking. So those healthy lifestyles, there's little to no osteoporosis in any of those 5 blue zone cultures. So it's, of course, they've been eating that way their entire lives. So just to answer, and they're not overweight either. So it's kind of, it's a lifetime of optimal lifestyle. You don't tend to develop osteoporosis. So, we're kind of fighting against our culture as far as how many years we've lived our lives, maybe not with the optimal lifestyle. And now we're trying to we either reverse the bone loss we've already created, or we're trying to prevent it. Now that we're at higher risk as older people, we're trying to prevent it from getting worse if you already have, say, bone thinning osteopenia. But so I just wanted to throw that out there too.
There are some notes in the chat that are significant, and that's the issue of soy and whether soy is good for the bones or bad for the bones, and whether it's good for breast cancer or bad for breast cancer.
Yeah, so the soy is good for the bones and good for breast cancer too. So it's because we have the 2 different receptors. So phytoestrogen is the estrogen that comes from soy, other than the other kind of estradiol and estrone and some of the other forms. So phytoestrogen, phyto meaning plant estrogen is what soy contains. And there's 2 different receptors. There's an alpha receptor and a beta receptor. And the alpha receptor is the bad receptor. That's the one that leads to things, estrogens stimulating cancer growth and estrogens causing bone loss and things like that, kind of the bad effects of estrogen if there's too much of it. Whereas beta receptor is actually the good receptor that actually goes and it improves bone health, improves breast health, all the places, the blood vessels, all the places you want the effects of estrogen. That's what the soy does. And we figured that out. It's been 10 years ago now. Actually, that was another lecture that was at the conference this past week, and they actually showed the official statement from the American Cancer Society and the Cancer Consortium, and they said estrogen is fine even with somebody that had breast cancer and has estrogen positive breast cancer. It's still considered okay, and it's actually associated with lower mortality from breast cancer and improved breast cancer survivability. So yeah, get your 3 to 5 servings of soy a day, mostly in the whole plant form, in the form of edamame and some of the other fermented soy, such as tempeh and miso, are some of the healthiest forms of soy.
Great. Annette.
I was just wondering, in those studies, did they use whole milk all the time, or did they use low fat or non-fat, or does it apply to all milks?
I'm not sure of the answer. You can go to nutritionfacts.org and look up the video, Is Milk Good for Our Bones? And he has all the sources and all the articles that you could be able to glean. It's a good question, but remember the issue here is the galactose that would still be in skim milk. You might have less fat, but you'd still have that issue with galactose.
Would you have galactose in, I don't know where that comes from, in like almond milk or not? Because
No, you would not.
Okay.
That's why plant milks are healthier choices. One of the reasons they're healthier.
Right.
You also don't have IGF-1, insulin-like growth factor 1, which is a hormone which stimulates the growth of cancer in all mammal milks, but not in any plant milk.
Thank you.
You're welcome. Okay, we're going to take 10 more minutes and look at 2 more videos. We're going to talk about what we thought was leaching from the bones, and we might find that it's a slightly different source of where calcium may be lost, but we'll learn what the way to prevent calcium loss from our body is from these next 2 videos. Okay, and then we'll have, questions again, whatever you want, we'll keep at it. Why don't you mute yourselves, whoever has unmuted or has it unmuted?
For most of the last century, a prevailing theory within the field of nutrition was that by eating acid-forming foods, such as meat, we were in essence at risk of peeing our bones down the toilet. And no wonder. Experiments dating back to 1920 showed over and over that if you add meat to the diet, you get a big spike in the amount of calcium being lost in the urine. And so this made total sense. We had known since 1912 that meat was acid-forming within the body, and how do you buffer acid? What are in antacid pills like Tums? Calcium. Meat and eggs have a lot of sulfur-containing amino acids, 2 to 5 times more than grains and beans, that are metabolized into sulfuric acid, which the body buffers with calcium. That's why the antacids like Tums are made out of calcium. Calcium can buffer acid. And where is calcium stored in the body? The skeleton. So the thinking was that every time we ate a steak, our body would pull calcium from our bones bit by bit, and over time this could lead to osteoporosis. Based on 26 such studies, every 40 grams of protein we add to our daily diet, we pee out an extra 50 milligrams of calcium. And look, we only have about 2 pounds of calcium in our skeleton, so the loss of 50 a day would mean losing close to 2% of our bone calcium every year. And so by the end of the 20th century, there was little doubt that acid-forming diets would dissolve our bones away. But if you actually look at all the studies done on protein intake and bone health, That's not what you find. So where's the flaw in our logic? Right? Meat leads to acid, which leads to calcium loss, which leads to bone loss, right? Well, it's uncontroversial that protein results in greater calcium excretion, but we've just been assuming it's coming from the bone. I mean, where else could the extra calcium dumped in our urine be coming from but from our bones? This is the study that appeared to solve the mystery. An intrepid group of researchers tried feeding a bunch of volunteers radioactive calcium, and then putting them on a high-protein diet. What happens when you put people on a high-protein diet? The amount of calcium in their urine shoots up, and indeed, that's just what happened. But here's the big question. Was that extra calcium in their urine radioactive or not? And to everyone's surprise, it was radioactive, meaning that the excess calcium in the urine was coming from their diet. Remember, they're feeding them radioactive calcium. So the excess calcium in their urine wasn't coming from their bones, but from what they were eating. What seemed to be happening is that the excess protein consumption boosted calcium absorption from down around 19% up to 26%. So all of a sudden there was all this extra calcium in the blood, so presumably the kidneys are like, whoa, what are we going to do with it all? So they dump it in the urine. 90% of the extra calcium in the urine after eating a steak doesn't appear to be coming from our bones, but from our diet. We're not sure why protein boosts calcium absorption. Maybe the protein increases the solubility of calcium by stimulating stomach acid production. Whatever the reason, yes, more calcium lost, but more calcium gained, such that in the end, most of that extra calcium is accounted for. So in effect, more calcium is lost in the urine stream, but may be compensated by less loss of calcium through the fecal stream. This was repeated with even more extreme diets, an acid-forming 5 burgers a day worth of animal protein diet that limited fruit and vegetables, versus an alkaline diet emphasizing fruits and vegetables. More calcium in the urine on burgers, but significantly greater calcium absorption, such that at the end it was pretty much a wash. Other studies have also since supported this interpretation. Here's an ingenious one. Feed people a high animal protein diet, but with an alkali salt to neutralize the acid. Now, the old thinking would predict that there would be no calcium loss since there was no excess acid to buffer. But no, even though the acid load was neutralized, there was still the excess urinary calcium, consistent with the radioactive isotope study, challenging this long-standing dogma that animal protein consumption results in an acidosis that promotes the excess excretion of calcium. So if our body isn't buffering the acid formed from our diet with our bones, how is it neutralizing the acid? Maybe with our muscles. Alkaline diets may protect our muscle mass, all covered in my next video, entitled Testing Your Diet with Pea and Purple Cabbage. Stay tuned.
I hope you take from that video that the body has a good ability to maintain its calcium balance, and that perhaps you need less calcium than you've been led to believe. Let's see the next video here.
If our body isn't buffering the acid formed from our diet with our bones, how is it neutralizing the acid? Maybe with our muscles. Our blood gets more acidic as we age, as our kidney function declines, and this may be a reason we lose muscle mass as we get older. The modern Western diet, based on animal products, generates an acid load that may cause a lifespan state of unnoticed and growing metabolic acidosis. And this chronic, low-level diet-dependent metabolic acidosis might contribute to the progressive shrinking of our muscle mass as we age. See, muscle wasting appears to be an adaptive response to acidosis. When our muscles break down, amino acids are released into the bloodstream. Our liver can then take these amino acids and make something called glutamine, which our kidneys can use to get rid of the excess acid. And indeed, in this 3-year study, those over age 65 eating alkaline diets were better able to preserve their muscle mass, which they think may be because the alkaline-producing fruits and vegetables helped relieve the mild acidosis that occurs with the ingestion of the standard American diet. But show me a study in which fruits and vegetables aren't associated with health benefits. So when the latest review asks, does an alkaline diet benefit health? If you're asking, does a diet low in meat, eggs, and dairy, all acid-producing, and high in fruits and vegetables, with lots of dark green leafies, well then of course the answer is yes, an alkaline diet benefits health. But if you're asking, does it matter what the pH of your pee is, whether your urine is acid or alkaline, regardless of what actually goes into your mouth, then the answer is actually still yes, it does matter, but the accepted benefits of having alkaline urine appear limited to two areas: a lower risk of kidney stones, and better uric acid clearance. We knew about the kidney stones, but the uric acid data is new. Researchers found that alkalinization of the urine is effective for removing uric acid from the body. And if you remember, uric acid is bad stuff, potentially increasing one's risk of fatal stroke, heart disease, and death. So, those eating plant-based diets are at an advantage. The average vegetarian diet is alkaline-producing, and the average meat-eating diet is acid-producing. Even though there are some acid-forming meat substitutes, like some of the corn products, they're not as bad as something like tuna. And they're typically consumed in smaller quantities than meat consumers consume meat. As the protein in plants is usually accompanied by much more potassium, which is alkalizing, there is good reason to meet protein needs preferably from plant sources. And if you actually measure urine pH, those eating strictly plant-based diets have the greatest advantage, significantly more alkaline urine than omnivores. How can you tell what your urine pH is? Well, you can be all boring and order some pH paper strips to pee on, or you can use what you should have right now in your crisper: a purple cabbage. Everyone should have a red or purple cabbage in their fridge, since it's one of the best nutrition bangs for our buck. But you can also do science with it. You can either boil some until the water turns deep purple, or a quicker, safer way, since you're not dealing with hot liquids, is to just blend some raw in your blender with some water for that gorgeous purple, and then just strain out the solids. Then what you do with that royal purple liquid is you pour it in the toilet bowl after you pee. You can imagine how much fun kids have with this. If it stays purple, your urine is acidic, and you should eat more dark green leafy vegetables. If the toilet bowl turns pink, your urine is really acidic, and you should eat more dark green leafy vegetables. You're looking for blue. If it turns blue, that means your urine is neutral, or even alkaline if it's sky blue, and that means you should continue to eat more dark green leafy vegetables.
One of my favorite videos. I actually had our grandkids try this out, and they had fun with it. I think it was a couple years ago when I first saw the video, 2 or 3 years ago. And one of the things I hope you gleaned is that you want more muscle mass, because that muscle mass will preserve your bone structure. Scott, any other thoughts? And then we'll take questions.
Yeah, so just what you said, so more muscle means better bone health. And so you probably picked up from that video. I know it took me a few times of seeing it and reading about it to actually understand it on a better level. So basically the kidneys, our blood calcium is so strict. And so if your calcium's too low or too high, it can cause heart problems and be really dangerous to our health. And so our kidneys know this, and our kidneys keep that really, really tight, that calcium level in the blood. So when you're eating lots of meat, lots of animal protein, that's very acidic. And so then, as you saw there, you start to absorb a lot of calcium. You're absorbing a lot of, well, let's keep that separate. So we're just talking about the muscle for now. So if you're okay, so you when you eat a lot of animal protein, you get a lot of acidity. Let's not talk about calcium yet. A lot of acidity in the blood, and to treat that acidosis, because our human body is slightly alkaline, and it wants to stay in that. It's in a really tight window as well, our pH in our blood. And so what happens is all that acid, basically what happens is the amino acids in our muscle, because muscle is made of lots of protein and those get broken down into amino acids. And so the amino acids get broken down from our muscle, and then that goes to the liver and makes this glutamine, which then the kidney takes that glutamine and makes ammonia with that. And then ammonia takes on hydrogen ions, which is acid. So think about acid as being, like hydrochloric acid. It's a hydrogen ion is what acid is. And so then that ammonia starts sucking up the extra hydrogen ions, the extra acid basically, and then that gets you pee that out then, and so because the kidneys want to keep the acid down. So basically by eating a lot of animal protein, you're going to break down more muscle, and we know that having more muscle is good for the bones. And so if you can eat a more plant-centered diet, you're not eating all that acid from the animal protein, and so then you're going to maintain your muscle. And so when you're exercising and doing all that, you're going to actually be able to more maintain and build muscle, and that's good for your bones. So that's one aspect of it. The other part of it was the calcium piece. And so the calcium is also very tightly controlled by the kidneys. And so when you eat the acid from the animal protein, you absorb more calcium. Like Dr. Greger said, we don't know exactly the mechanism of why we absorb more calcium when we eat animal protein, but we bring in more calcium into our blood when we eat animal protein, and the kidneys say, hey, I can't, this is too much calcium. So then the kidneys send the calcium into your urine and you pee out more calcium. And that's why people that eat more animal-based diets, lots of animal protein, have more calcium in their urine, because they're absorbing more of it, but the body can't abide by that, so it sends more of it to the right amount to the urine. And then we know having calcium in your urine, that puts you at higher risk for kidney stones, because of all that calcium that's floating around that combines with either oxalates or some of the other minerals and stuff, and you get more kidney stones. And so that's another reason that you don't want to eat lots and lots of animal protein, because of that as well. Does that make sense? Any questions about that? I think it's important, because you always hear, even in some of the older videos, even with Dr. Barnard and some of the other older videos, they talk about, we just always assumed that the calcium what got stolen from the bones when we eat a high acid load from animal protein, and really that's not the case when we look at the more recent science. So any questions about that?
Okay, no sense being shy. Feel free to speak up and see if there is something.
Regarding the fallibility of DEXA scans, my wife's an avid cyclist. She's had 2 bad spills. One, she's in the hospital for 5 days with lacerated liver. She had a bone bruise for 6 months at least. She was told she has brittle bone disease, and she's never had any fractures from these bad spills. So she questions DEXA scans.
Yeah, and so does Pam Popper on YouTube. And I'll share that video for anyone who's interested. Any other thoughts? I'm gonna share the video by Pam Popper is DEXA scans useless for determining bone health, for those who are interested in checking that out further. Okay, anybody else? Going once, going twice? Okay, ever onward.
Why don't they test our urine anymore?
You mean for alkaline or?
Well, doctor, why don't? Yeah.
Yeah, why, it does get tested. You get a urinary pH on every urine dipstick. It's just, it may not be addressed by the provider because they don't feel there's any issue with it, because they don't understand about plant-based and alkaline diets, or don't believe it makes a difference or whatever. I didn't for many years. Okay. Are there any other screening tests for osteoporosis? I don't think so, other than if you did an X-ray, either it's a DEXA scan or it's an X-ray of some sort, like X-ray of your vertebrae or X-ray of your hips. But if you see significant bone thinning on X-ray, you probably have osteoporosis.
Yes, Charlie, I had something to ask Scott. My doctor is wanting me, and he knows her, wants me to get a DEXA scan. And now I am so confused about what to do, because I have a doctor I trust telling me this, a PA I trust with other issues. I am caught in the middle. I'm told that spinach with oxalates should not be eaten in excess because they cause kidney stones and gallbladder trouble, because our daughter's been told that. There is so much conflicting information. And now coming from the doctor, what do I do? Because I know I have osteopenia and I'm doing everything I can. I have good body weight. I've lost so much weight on this diet, I can't lose anymore. My husband will pull me off of it very soon now. I'm caught in the middle of trying to figure out what is the best thing for me to do. And I have no idea, except prayer. I'm just caught in the middle of everybody. Do you have some suggestions? Should I do the DEXA scan? Should I listen to my doctor? I don't know what to do.
It just depends on what you're planning to do with the information. So it's,
Yeah.
you know, DEXA scans are the standard of care. So it's not like it's wrong to do it. It's just you have to realize that there's a lot of problems with the DEXA scans. They, you know, if you use the exact same machine every time with the same technician, then it's actually pretty good data. It's pretty accurate, but that's not what happens. Every DEXA scan machine's different, and the technician, and the numbers can be really inconsistent. So I think the really important thing is just, I mean, if you've already had one and you're just monitoring, and it's going to help you decide what treatment to do, it's going to help you decide whether you're going to, you know, do Prolia or another bisphosphonate or one of the other medications, then maybe it's helpful. But it's just like, you can't really blanket say whether you should do it or not for a population of people. It's just a matter of each individual person. You look at their risk factors, what's their diet, what's their lifestyle. Those are the things that almost all providers don't take into account because they're not educated on diet and lifestyle. So it's just a matter of, okay, you're following the standard American diet, you're smoking, what are your risk factors? Then you're probably at high risk for osteopenia, osteoporosis. And then if you're not going to, you know, do a diet and lifestyle change, and it's going to help you determine whether or not you're going to take one of these drugs, then there's probably some value to doing the DEXA scan. But if you're somebody that's, you know, you're exercising, you're not smoking, you're eating a plant-centered diet, all those things, then it's kind of, well, all the stuff we talked about in the introduction there, then it's kind of debatable whether it's going to help you or not. If you're already deciding, well, I'm just going to focus on diet and lifestyle, I'm not going to take one of these drugs because of the side effects and the cost and things like that, and some of the other issues you might talk about here in a little bit, then there's really no reason to do the DEXA scan, because it's like you want to have a reason. Is it going to help you make any kind of decision? And if it is going to help you make a decision, then maybe it has some value. If it's not going to help you make a decision, then you probably might want to decide not to do it.
Okay.
Does that help?
Well, kind of. I think it's hard to make any decision at this point because of so much conflicting information. And I'm of ideal weight. I exercise, I walk. We're going to get a rope machine soon, so I'll have more resistance. I really don't know what to do, except what I have fallen before and tripping over things. I have never broken anything.
So if you've never broken anything, the number needed, if you do a Google search for the number needed to treat, you will find that 50 people need to be treated with Fosamax to help one person prevent one fracture.
Mm.
If you want to take the risk of the side effects of the medicine with that statistic, then go ahead and get a DEXA scan if you think you have osteoporosis. They're not going to put you on Fosamax if you only have osteopenia. If you had osteoporosis and you have not had a prior fracture, it only prevents fractures of your vertebral column. It doesn't prevent the life-threatening hip fracture.
Mhm. Okay. And
So-
I am seeing more and more doctors putting patients on, Prolia shots or other bisphosphonates like Fosamax with osteopenia these days. And I'm not sure if that's a trend or what's going on with that, but I've been seeing that.
Yeah, so drug companies are pretty good at advertising, but if we're looking at numbers needed to treat at the statistics that I just researched, maybe they're adjusted, maybe I got on the wrong site, but I don't think so. I think it's a very hot topic. It's been very confusing for a lot of people, and we're sorry about that, but that's just the state of affairs right now.
Mhm. Okay. Well, thank you very much. I would like to find an alternative to rice milk. I've written Lisa about it, and we'll put it on the website, but I miss low-fat buttermilk. Growing up in the Midwest, I loved it. I haven't had any now for over a year, but I miss yogurt. I can't find any yogurt plant-based without sugar. And so I'm eating lots of vegetables, but I appreciate your insight, and I would rather not have the DEXA scan. They haven't been particularly helpful, just to show that I have it, but I get no advice as to what to do. And I'll continue researching and listening to videos and go from there.
And just remember, you're the captain. You're the captain of your own ship, and don't let anyone persuade you. It's just everyone can make recommendations, whether it's me or your doctor or your family members. But you're the captain of your own ship. Don't ever let anybody, try to, strong arm you into doing something you don't want to do. So
Yes.
you're in charge.
Yeah, I agree. I've studied nutrition and I know a little bit, but this is a whole new realm for me with plant-based, but I appreciate your insight, both of you. Thank you.
Okay, you're welcome. So we're going to do a couple more videos here, and this is about calcium because a number of you are in the impression that taking calcium supplements is a healthy and safe thing to do, and that you may be taking them now, or you may have heard that's the right thing to do to prevent bone loss. Well, let's take a listen to some of the science connected with that. And it's, are calcium supplements safe, first of all, and then are they effective? So let's check it out.
In 12 short years, government panels have gone from suggesting widespread calcium supplementation may be necessary to protect our bones to do not supplement. What happened? It all started with a 2008 study in New Zealand. Short-term studies had shown that calcium supplementation may drop blood pressures by about a point, though the effect appears transient, disappearing after a few months, but better than nothing. And excess calcium in the gut can cause fat malabsorption by forming soap fat, reducing saturated fat absorption and increasing fecal saturated fat content. And indeed, if you take a couple Tums along with your half bucket of KFC, up to twice as much fat could end up in your stool, and with less saturated fat absorbed into your system, your cholesterol might drop. So the New Zealand researchers were expecting to lower heart attack rates by giving women calcium supplements. To their surprise, there appeared to be more heart attacks in the calcium supplement group. Was this just a fluke? All eyes turned to the Women's Health Initiative, the largest and longest randomized controlled trial of calcium supplementation. The name might sound familiar. That's the study that uncovered how dangerous hormone replacement therapy was. Would it do the same for calcium supplements? The Women's Health Initiative reported no adverse effects. However, the majority of participants were already taking calcium supplements before the study started. So effectively, the study was just comparing higher versus lower dose calcium supplementation, not calcium supplements versus no calcium supplements. But what if you go back and just see what happened to the women who started out not taking supplements, and then were randomized to the supplement group? Those who started calcium supplements suffered significantly more heart attacks or strokes. Thus, high dose or low dose, any calcium supplementation seems to increase cardiovascular disease risk. So researchers went back digging through other trial data for heart attack and stroke rates in women randomized to calcium supplements with or without vitamin D added, and confirmed the danger. And most of the population studies agreed. Users of calcium supplements tended to have increased rates of heart disease, stroke, and death. The supplement industry was not happy, accusing the researchers of relying in part on self-reported data, like they just asked people if they had a heart attack or not, rather than verifying it. And indeed, long-term calcium supplementation causes all sorts of gastrointestinal distress, including twice the risk of being hospitalized with acute symptoms that may have been confused with a heart attack. But no, the increased risk was seen consistently across the trials, whether the heart attacks were verified or not. OK, but why do calcium supplements increase heart attack risk, but not calcium you get in your diet? Perhaps because when you take calcium pills, you get a spike of calcium in your bloodstream that you don't get just eating calcium-rich foods. Within hours of taking supplemental calcium, the calcium levels in the blood shoot up and can stay up as long as 8 hours. This evidently produces what's called a hypercoagulable state. Your blood clots more easily, which could increase the risk of clots in the heart and brain. And indeed, higher calcium blood levels are tied to higher heart attack and stroke rates, so the mechanism may be calcium supplements leading to unnaturally large, rapid, and sustained calcium levels in the blood, which can have a variety of potentially problematic effects. Calcium supplements have been widely embraced on the grounds that they are a natural, and therefore safe, way of preventing osteoporotic fractures. But it's now becoming clear that taking calcium in 1 or 2 daily doses is not natural, and that it does not reproduce the same metabolic effects as calcium in food, the way nature intended. And furthermore, the evidence is also becoming steadily stronger that calcium supplementation may not be safe. That's why most organizations providing advice regarding bone health now recommend that individuals should obtain their calcium requirement from diet in preference to supplements. But if we can't reach it through diet alone, would the benefits to the bones outweigh the risks to the heart? We'll find out next.
And that's what we're going to do. Find out next.
There has been an assumption for decades that as a natural element, calcium supplements must intrinsically be safe. But calcium supplementation is neither natural nor risk-free, but the same could be said for every medication on the planet. Yet doctors continue to write billions of prescriptions for drugs every year, because the hope, at least, is that the benefits outweigh the risks. So what about the benefits of calcium supplements? Yes, heart attacks and strokes can be devastating, but so can hip fractures. The risk of dying shoots up in the months following a hip fracture. About 1 in 5 women don't last a year after a hip fracture, and it may be even worse for men. On average, apparently cutting one's lifespan short by 4 or 5 years. And unfortunately, these dismal statistics don't seem to be getting much better. So even if calcium supplements caused a few heart attacks and strokes, if they prevented many more hip fractures, then it might result in a favorable risk-benefit ratio. So how effective are calcium supplements in preventing hip fractures? We've known that milk intake doesn't appear to help, but maybe that's because any potential benefit of the calcium in milk may be overshadowed by the increased risk of fracture and death associated with the galactose sugar in milk. But what about just the calcium in a calcium supplement alone? Calcium intake in general does not seem to be related to hip fracture risk at all. And when people have been given calcium supplements, not only was there no reduction in hip fracture risk, an increased risk is possible. The randomized controlled trial suggests a 64% greater risk of hip fractures with calcium supplementation compared to just like getting a placebo sugar pill. Where did they even get this idea, then, that calcium supplements might help our bones? It was this influential study in 1992 that found a combination of vitamin D and calcium supplements could reduce hip fracture rates 43%. But this was done on institutionalized women, like in a nursing home, who were vitamin D deficient. They weren't getting sufficient sun exposure, and so if you're vitamin D deficient and you take vitamin D and calcium, no surprise, your bones get better. But for women living independently, out in the community, the latest official recommendations for calcium and vitamin D supplementation to prevent osteoporosis is unambiguous: do not supplement. Why? Because in the absence of compelling evidence for benefit, taking supplements is not worth any risk, no matter how small. Now, this is not to say these supplements don't play a role in treating osteoporosis, or that vitamin D supplements might not be good for other things, but if you're just trying to prevent fractures, women living outside of institutions should not take them, and perhaps even in institutions. In this study, instead of giving nursing home residents vitamin D and calcium supplements, they randomized them to sunlight exposure and calcium supplements, and those that got the calcium pills had significantly increased mortality, lived shorter lives than the sunshine-only group. Although calcium supplements don't appear to prevent hip fractures, they may reduce overall fracture risk by like 10%. So here's how the risk-benefit shakes out. If 1,000 people took calcium supplements for 5 years, we would expect 14 excess heart attacks, meaning 14 people would have a heart attack that they would not have had if they had not started the calcium supplements. So they were effectively going to the store and buying something that gave them a heart attack, plus 10 strokes that otherwise would not have happened, and 13 deaths. People would have been alive had they not started the supplements. But that's all balanced against the 26 fractures that would be prevented. Now, it's no fun falling down, breaking your wrist or something, but I think most people would look at that risk-benefit analysis and conclude that calcium supplements are doing more harm than good. Given these findings, the use of these supplements should be discouraged, and individuals advised to obtain calcium from their diet instead. Calcium supplements have been associated with elevated risk of myocardial infarction, heart attacks, whereas dietary calcium intake has not. How much calcium should we shoot for? Interestingly, unlike most other nutrients, there's no international consensus. For example, in the UK, the recommendation for adults is 700 milligrams a day. But across the pond in the US, it's up to 1,200 a day. Whenever I see that kind of huge discrepancy between government panels, I immediately think scientific uncertainty, political maneuverings, or both. Newer data, based on calcium balance studies, in which researchers make detailed measurements of the calcium going in and out of people, suggest that the calcium requirements for men and women is lower than previously estimated. They found calcium balance was highly resistant to change across a broad range of intakes, meaning our body is not stupid. If we eat less calcium, our body absorbs more and excretes less. And if we eat more calcium, we absorb less and excrete more to stay in balance. Therefore, current evidence suggests that dietary calcium intake is not something most people need to worry about. This may explain why in most studies no relationship was found between calcium intake and bone loss anywhere in the skeleton, because the body just kind of takes care of it. Don't push it too far, though. I mean, once you get down to just a few hundred milligrams a day, you may significantly get more bone loss. Though there may not be great evidence to support the US recommendations, the UK may have the right idea, shooting for between 500 and 1,000 milligrams a day from dietary sources, unless you've had gastric bypass surgery or something and need to take supplements. For most people, though, calcium supplements cannot be considered safe or effective for preventing bone fractures.
Well, that was more than a mouthful. but it was a very important video. And I hope that you find that video valuable. Any questions or thoughts on this?
Dolly here.
Hi, Dolly.
Hi. I do have osteoporosis, and my doctor, when she first discovered it, said that she wanted me to be on the extra calcium supplements and the vitamin D and on down the line. Plus, I have this osteoporosis pill that I take once a week.
Mm-hmm.
And so, but since I've been taking this class, I have taken myself off of the calcium supplements. And now I'm wondering about the vitamin D. Could you help me?
So the vitamin D, you can adjust that by getting a vitamin D blood level. And if your blood level is above 30 for what you're taking, then you're good. In winter is probably when you want to be sure to take it. In summer, you may be getting more sun if you're getting out. But if you don't get much sun during summer, get a vitamin D level, have your doctor order that. Since you have osteoporosis, it should be paid for. And then you could adjust how much vitamin D is a reasonable amount for you to personally to take. I take anywhere, like in summer, if I'm working out in the yard, I may not take any if my skin is starting to darken up and I've had a lot of sun exposure. But generally, if I haven't, I usually do 1,000 to 2,000 every day in summer, and I do 5,000 in winter. So Dr. Greger recommends 2,000 units a day for most people living in Oregon.
Well, that's what she suggested for me as well. So I'll still keep on the vitamin D for a while, I think.
You keep on the vitamin D, but it would be valuable for you. Sometimes based upon your weight, other kinds of factors, you may require a bit more. And so getting a vitamin D level, I think, would be a very reasonable thing to ensure you're getting adequate amount.
Thank you very much.
You're welcome. Annette.
Eugene naturopath that I know recommended to my friend who was very at risk for osteoporosis to take strontium daily for a year, and then after a year do it 3 times a week. So I've heard things like the strontium in Europe is different than in the US, and so they do that in Europe, but it's a different strontium. And I tried it for a year because I have osteopenia, and then just recently in my wrists, it was diagnosed through the DEXA scan to be osteoporosis now. But I'm always been very small boned, thin when I was, all my life. So I think that's my risk factor because I did weights and, did all the right things otherwise. Anyway, I was wondering if you had any information on strontium.
Well, my first comment about strontium is that I haven't really seen any studies that show that it's indicated for osteoporosis. Scott may have seen something like that, and he'll tell us in a moment or not. And the other thought that comes to my mind is, man, there's a lot of people with osteoporosis that there never were before. And it just seems like we would be dropping over like flies with the amount of people who are worried about this topic. I wish we were as worried about heart disease and diabetes and overweight in our country as we are about osteoporosis. I think of the word doctor mongering from Dr. John McDougall when I hear so many people who are so worried about osteoporosis and yet really not a whole lot of discussion on these other topics. It's considerably less life-threatening, but it has been made into a major health crisis in our country. And of course, for those people who have a hip fracture and wind up in the nursing home, of course, it's a very significant issue. But if you compare that to the number of people who are suffering complications from diabetes and heart trouble and arthritis and other kinds of things, probably pretty minimal in my experience. Scott?
Yeah, I haven't seen any science or studies on strontium. It's difficult. I mean, I don't know if Dr. Greger has anything on it, or if I know it's difficult with supplements because they're not FDA regulated. So you don't really know what you're getting. And I mean, it can be that way with calcium as well, but yeah, I don't know any specific studies about it in relation to bone health or anything else.
Yeah,
Kim?
I've never done calcium as a, old senior, because I've also feel like a lot of that is set 20 years before, is when it really matters. And the other thing that always bothered me is with the DEXA scans, especially when they diagnose you with osteopenia, they're comparing you to someone in their 30s. They should compare you to the average, 65-year-old and then see where you're at.
That is an excellent point. And it's like, everybody's going to have osteoporosis in comparison to when they were 20 years old.
Mhm.
Yes, Kim.
So I had a question about heart instead of bone so much. So I've heard on this with you guys and from other people that people take the calcium scan to see about calcium in your bloodstream, I think.
A calcium score. It's
Calcium score.
calcium that collects in your coronary arteries.
Does that have anything to do? Is that an excess of calcium?
Well, it's a deposition of calcium in the arterial wall, generally related to atherosclerosis, hardening of the arteries and the plaque buildup and that sort of thing.
So is that routinely tested? I've never been tested for that. Should I be tested for that? Should all of us be tested for that?
I haven't been tested for it. I don't think I need to be tested for it. It's like, it depends on what your risk factors are, whether you're having symptoms, whether, what activities you're engaged in. It's a discussion of what are my heart risk factors. And if they are significant and you're choosing to eat things that are going to put you at more risk, like the standard American diet, but if you're eating healthy and you're exercising and you're not smoking and you're doing everything you can, then there may not actually be a need to do that. But if you need motivation to get on the train, then doing a calcium score is a technique that some people use to encourage their patients. Hey, look, you've got a calcium score and your cholesterol's high and you're at risk of having a heart attack. Oh, I better do something different then in my life. If you're already doing something different, probably not an issue. Scott?
Yeah, it can also work the other way where, I've had patients where their cardiologist actually took them off of their statin because they had a really low coronary artery calcium score, like almost zero. And so then I guess as long as that patient doesn't go, oh, I'll just eat whatever I want and smoke and not exercise because my coronary artery calcium score is low. So that could work against you as well. But because the thought is, basically, I don't know if there's any correlation between, or calcium supplementation and coronary artery calcium scores or not. I don't believe there is, but
I don't think so either.
Yeah, so it's basically just a calcified plaque, is a plaque that's been around a long time. Just like you have bone spurs in your joints when you have lots of arthritis for a long period of time, right? And so it's basically what that is. And so the thought is if you have old plaques that have calcified, you probably have younger, more vulnerable, softer plaques. Those are the ones that actually are the ones that rupture and cause heart attacks. And so they kind of refer to a coronary artery calcium score of being high or low as being what your plaque burden is. You'll hear a cardiologist say your plaque burden, and that just means how much plaque do you have in your coronary arteries based on your coronary artery calcium score. So it's, the best way to kind of think about it is it's the number one cause of death in this country since 1918 is coronary artery disease, heart attacks. And so everyone's at high risk, basically. Anyone that's older than 10 years old and eats a standard American diet is at high risk for heart disease and dying of a heart attack. That's the #1 killer. So people in this group that are trying to go on a more whole food, plant-based diet, exercise, get good rest, not smoke, do all these things we're talking about in these classes, you're actually making a bigger impact on reducing your risk for heart disease by making those changes. If you're somebody that's has a really poor lifestyle, then that getting that test might be worthwhile, as far as like Charlie said, to motivate you to make improvements in diet and lifestyle. Or sometimes people will have, on the other side of it, kind of playing devil's advocate, if you have pretty low cholesterol numbers that are pretty good, but then you have a high coronary artery calcium score, then they might want to check a few other blood tests for some of the subfractions of cholesterol and ApoE and LP little a and all these other things that cardiologists will sometimes check, because like, oh, you look like you're at low risk, but because of heredity and some of these other coronary artery calcium and some other tests and markers in your blood, you're actually at a fairly high risk. And so that where it actually might be helpful to make a decision as to maybe taking more medication or doing a diet and lifestyle change. So it's an individual case-by-case basis again for some of these types of tests.
So it's calcification, not calcium. Really, it's not calcium that's in your system. That's
well, it is calcium. It is calcium, but it's not. Yeah, there's no correlation between how much calcium you're taking in and then whether you have calcium in your arteries or in your joints or whatever.
Thank you.
Yeah, you're welcome.
Thank you so much.
It's a good question.
And that's a blood test, right? It's a blood test?
It's a CT scan it's a X-ray scan of your chest for a calcium score.
Oh, okay, thanks.
Doug, I'll get you with you in a second. Someone asked, what's the best whole food sources of calcium? It's the greens and the beans in your life. And the biggest source of calcium for greens is what Christine and I eat every day. We eat about a cup of collard greens. They have about 225 milligrams of calcium. So we have a cup of that every day. And you get calcium from other greens and also beans. Okay, Doug.
I'm new to all this. I saw an interview of Dr. Esselstyn today, so today I went off with oil. But to reverse heart disease, how much plant-based fat are you allowed to eat?
So he recommends 10%. I don't know if he says maximum 15%, but it's hard to do 10%. But I think when he counseled his patients, he tried to keep them close to 10%. That's my understanding. How about you, Scott? What do you think?
Yeah, and that's about what you would get just without even trying if you're eating nothing but whole plant foods and you're avoiding the nuts and the avocados and the oil like Dr. Esselstyn recommends for his heart disease patients. But if you're just eating, beans and fruits and vegetables, whole grains, as not processed foods in any way, you're going to get probably about 10 to 15% of your calories from fat. If you start adding in more than a handful of nuts or half of an avocado and nut butters, and then if there's any oil that gets in there, then you're going to be shooting up, to 20, 25, 30%. So, yeah.
Thank you.
If you're interested in reversing heart disease, shoot for 10%, 10 to 15 at the most.
Thank you.
That's of your total calorie intake. So a quarter cup of nuts is 150 calories. So if you're eating a 2,000 calorie diet, then 200 calories would be 10%. So you're going to be getting some of that from your other foods. So you're right about 10%.
I've been losing weight. I possibly have celiac disease. So I've been eating 2,500 calories a day.
So up to 250 calories of fat, there's 9 grams or 9 calories per gram of fat. So however that works out for your life. So
Okay,
you're avoiding all all foods with gluten in them?
Yes.
Okay, good. Hopefully it starts turning around.
Do you know anything about xanthan gum? I've heard some negative things about that. Some people with celiac disease have issues with that.
I wasn't aware of that. How about you, Scott?
Just nothing, but it is I guess, preservative of some sort, right? That's what I understand.
They put it in flours, non-wheat flours for the texture.
Yeah, so if you're eating a whole plant, a whole food plant-based, you're eating foods that are grown in nature. You're not eating a lot of, maybe not any foods that have flour or those kind of additives.
Yeah, I stopped that. I was getting some from Trader Joe's, but I've stopped doing that too.
Good. Eat oatmeal. Eat bulgur.
But my
But
wife's a
not
baker.
bulgur because that has wheat. Eat oatmeal.
Yeah,
Eat quinoa.
a lot of quinoa.
And what else? I don't know.
Eat farro.
Farro. Yeah, there you go.
Yeah, I mean all those grains.
Good. And beans and lentils, you can have those, and fruit and vegetables, whole bunch.
Yep.
Good.
It's hard to eat 2,500 calories though after stopping eating nuts and avocado. I was depending on that for some of my calories. But
Well,
after eating Esselstyn, I've stopped today.
is heart disease a concern of yours?
I have abdominal aortic aneurysm, and my
Yeah.
doctor said that's the result of atherosclerosis. I had a brother who died at 61 from a heart attack.
Yeah, so
He had a lot of other risk factors that I don't have though.
you're going to be eating more beans and hummus, and they have a Chipotle no-fat hummus at Whole Foods, and I think also at Market of Choice. We've been getting that. It's really good. They have one that's I think basil, and another one that's, I don't know, balsamic. They're pretty good. We've been eating those, and more beans, lentils, rice, potatoes. Those are 400 to 600 calories a pound. So, stock up on those.
Yeah.
And I just looked, farro has a little bit of gluten in it.
Oh, does it?
Yeah, I have the quick reference guide to cooking whole grains on the class website.
Well, you better be careful about farro then.
Oh, sorry, I did not know that.
I know,
Okay,
didn't.
well,
I forgot about that too, actually.
okay. Soy, are you able to eat any soy?
I decided to stop eating soy, no dairy, of course, dairy is whole food. I don't do that. But anything that might cause that some people have some intestinal distress from, I'm not eating. And so I've eliminated soy. I was eating quite a bit of soy, but I'm going to be, I had those hormone tissue something or another hormone thing test, and is off the scale for celiac disease.
Uh-huh.
And so I had a endoscopy, and but I've been off gluten for 6 weeks. GI doctor put me on gluten for 6 days. Wasn't able to determine that the visually or biopsy that I had celiac. He thinks I have it, so he wants me to be off gluten for till November, and then test the blood again. He said that hormone, I forget what it's called, should drop back down if I do have celiac. So that's what's happening.
Oh, I see. Well, eating soy, soy has some amount of calories in it because of some of the fat content in it, but it's a healthy fat. So
I'll be going back on it after this testing period.
okay, good. So we've been doing pretty good here. We had some other videos. One of them was on vitamin D. Make sure you maximize the dose. And the way you do that is you can get a blood test. You could do it at your doctor's office. It's about $200, maybe more now. Online, it was $50 a couple years ago or a few years ago when I did mine. You just stick your finger and get a few drops of blood and you put it on this, card and send it in, and they give you the results online. It seemed to work okay. And then the other issues are almonds can be helpful for osteoporosis, phytates, which you'll get in beans, and prunes for osteoporosis. Dr. Greger has those videos on his nutritionfacts.org. If you just do a search for osteoporosis, if this is the topic you're interested in, you'll find those videos. And then there's another YouTube called Bone Health and Plant-Based Diets with Dr. Bernard. It's 4 minutes. And for those of you who are concerned that you may have an increased risk of bony fractures because you're eating plant-based, he discusses that and talks to you about why you still want to do whole food plant-based eating.
And then I was going to say next week is open forum, so we could if people don't have a lot of other topics to talk about, we could show some of those videos and continue the conversation if you wanted to. Great
idea. I didn't think of it. That's why it's good to have you.
Yeah.
In the room. Okay. Anybody else have anything that they want to say?
Hank here.
Hank.
My question is it possible to have too much calcium in your system? The reason I ask is I've got a couple of conditions that involve calcium. One of them is bone spurs, and the other one is a vertigo condition caused by a buildup of too much calcium carbonate crystals in the semicircular canals of your inner ears. And wondered if that could be helped in any way.
Well, there are conditions where you get increased calcium levels. Some cancers can cause your calcium level to be outside the normal range. There are hyperparathyroidism, where your parathyroid glands are overproducing hormone, which cause your calcium to be high. And so, but the conditions that you mentioned, I think have more, in my mind, more of a genetic component than a elevated calcium level. You would have an elevated calcium level on a routine chemistry panel that your doctor would look at and say, oh man, this is high. We better check you out for some other illnesses here. But I don't think that those illnesses are in the category of those osteophytes and the otoliths or whatever it is in the ear. I think those are more just miscellaneous things that people get, not necessarily life-threatening.
Thank you. It's just a kind of inconvenience. Thank you.
You're welcome.
Yeah, the body keeps besides those rare situations or less common situations Charlie talked about, the body keeps the calcium pretty tightly controlled. And as you saw from Dr. Greger's video, the body's smart. When we need more calcium, we absorb it better. When we don't absorb it. So it's and one of the embarrassing things for the dairy industry, it probably occurred 10 or more years ago, when the start of the trend of less dairy intake, and they're starting to expand to other countries because it's starting to go down in the United States because of all the dairy alternatives that are around now. They're actually trying to, last ditch effort, as the ship's starting to sink, they're trying to look for cases of calcium deficiency. So they actually hired a staff of scientists to research the medical literature to find cases of calcium deficiency in the world literature, and they couldn't find any. So it was pretty embarrassing for them because that well was dry. So yeah, calcium is just not really a nutrient of concern, just like protein's not a nutrient of concern. What's our nutrients of concern? Fiber and micronutrients, phytochemicals, that's the nutrients of concern, and all those nutrients you can get from eating whole plant foods, and you get all the protein you need from whole plant foods, you get all the calcium you need from whole plant foods. So just a little bit of wisdom to end off the night here.
Any other thoughts from anybody? Yes, Doug.
A friend wanted me to ask you regarding B12 supplement. Is sublingual better than just taking it orally?
Yes.
I'd prefer it, yeah, just because some people, if you swallow it, and if you have acid reflux problems, or you're having to take Tums or Pepcid or Prilosec because you have acid reflux problems, which usually go away when you're on a plant-based diet. But if you have those issues or absorption issues because of bariatric surgery or whatnot, then it's better just to take it under the tongue. It absorbs, and most of it goes into your bloodstream that way. So if you have a choice, go for the sublingual. That's what I take.
I take sublingual now, but for about 6 or 8 years, I took oral, not knowing any better, and I lived. And so you can tell him if he has a bottle, he could finish it off without dying. But probably, like Scott says, we would currently recommend people do sublingual. And to do the cyanocobalamin as opposed to methylcobalamin.
And my docs also say to try to do it on an empty stomach, like first thing in the morning. I'm not.
Well, if you're absorbing it sublingually,
Yeah.
it's going through the mucosa of your in your mouth,
Mhm.
getting absorbed that way. So it wouldn't really make that much difference whether you're taking it on an empty stomach or not, unless you chew it up, which I sometimes do, and it winds up in my stomach, and then it may not get absorbed quite as quickly. So, but the doses that you're taking, if you're following Gregor's recommendation, which is 2,000 micrograms a week for those under age 65, or 1,000 micrograms a day, are pretty high doses, and you're likely going to probably get enough absorption.
1,000 micrograms a day is for people over 65, just to finish that thought.
Thank you. Age takes its toll and diminishes the thought process sometimes. So it's good to have youth in the room to carry on. I love it. Hey, this has been fun. Scott, I've enjoyed it.
Yeah, good class. Thanks for coming, everybody.
Thank
And
you.
yeah, thank you, everybody. And we look forward next week. We'll have some more. Maybe you'll have some other questions from this. And like Scott said, we can play some of the other videos, and just bring what other questions that you have too. We'd love to have you.
And hope to see as many of you as possible on Saturday at 10 o'clock for the walk.
You guys have a good week.
Okay,
Thank you.
take care.